This time is the third time when I came for treatment. Yes, of course, I'm very satisfied with the treatment. I'm very satisfied with everything here. My name is Gabi. I came from Romania. I have 39 years old and I'm a spinal cord injury patient, C5-C6 level of injury since 23 years ago. Well, first of all, epidural stimulation and mapping session, and of course the therapists, because they are very good and very well, they have a big experience, and the facility in the for the third time also. So in a word, in a sentence, mapping sessions, therapists and the facility. Well, the big obstacle for us and of course for me this time was quadricep muscle, because when I left the hospital first time my quadricep muscle was very weak. So I came here just to improve this situation, to get bigger and more muscle strength and more muscle activity, especially to be able to work with the quadricep muscle and of course with hip flexion, because quadricep was weak and hip flexion for the right leg was good, but for the left leg was a little weaker. So that's why we came to improve this, to get more programs and to be able to stand and to be able to lock the knees and to be able to take some steps, assisted of course with the hoist. As I said before, I came here for improve the quadricep muscle and hip flexion, which was happened here this time. Finally we found 3 new programs, and now I was able to stand a little bit with assistance, to lock the left leg because the right leg now is a little weaker, and of course to take steps with a walker, assisted steps with the help of therapist, because I don't have enough muscle and don't have enough muscle strength to be able to support my own weight. But this was my aim for this time, to came here just to get quadricep muscle to get better, to be able to stand and to take assisted steps with the walker. When I came back home, I was just doing and I'm still continuing to do physical therapy every day, and of course to practice and train with epidural stimulation device every day. But just this, no other treatments. Because I was the first Romanian patient treated with epidural stimulation device, I was in touch with a lot of patients from Romania and from abroad also. And anyway, I was in communication with them and I kept in touch with them to give them a lot of information and a lot of details about my treatment, about my story, about how was my epidural stimulation procedure here. So because anyway I was in touch with them and I still communicate with all the patients. Once I met Unique Access team and once I met the medical staff here in the hospital, I saw they are very responsible and they work with a very big responsibility. They have experience and they are very dedicated persons to all the patients here, not only to me. So I wanted to join in their team to be able to offer more information to the patients, and it's like we are in a big family, because it's nice to share experience and nice to share your story with others and to be able to help others at least with information. If I cannot help others, I can help with giving them information and details about this. I would recommend to all the spinal cord injury patients to believe that and to trust in this treatment, because it was really worth it for me and for the other spinal cord injury patients. And of course, it's really worth it, each single dollar. And the treatment is very safe, efficient. The facility is international accredited. The medical staff is very well experienced. The therapists are well experienced. So to trust in this treatment and to be open to get this treatment, because I believe this treatment is the future, is a very innovative treatment for spinal cord injury patients. So I believe today, nowadays, this treatment is most advanced treatment available for spinal cord injury patients, and of course for other patients with other conditions, it is still available to get stem cells treatment here.